Dr. Timothy A. Skaggs, the president and I guess you would say founder of Complete Chiropractic and Wellness Center here in Joliet. We've been in the Joliet area for almost 3 years now. We're just starting to get a real solid foundation and seeing more and more people all the time. I actually opened up this office right out of school. You know, I graduated right out of Logan College of Chiropractic, and they give you a fairly decent package to give you the business skills necessary to open up a place, so I decided to just go for it and get started right away. What I've tried to do with my business model to make me unique to this area is provide more than just your average sort of injury-based care for, you know, conservative methods, which means chiropractic, manual therapy, massage, physical therapy, exercise therapy, things like that. We get into all of that, but we try and do a little bit more than that. We get into areas of nutrition and overall wellness that many times other physicians are too busy or just not terribly concerned about. So that's where I try and be as helpful as I possibly can in getting a complete picture of what your health is and how I can be able to help you out. My office number is 815-729-2490 if you'd like to schedule a consultation or have any questions that you'd like to ask me. Also, our web address is www.completechiro-and-wellness.com. I can be reached on email at completechiro-and-wellness@gmail.com. If you're at all curious about what it is that I do or how I'm different or anything really at all, any health concern that you might have, any sort of ache and pain that you might have, I always do offer a free consultation. So if you're worried about how much it's going to cost you to come see a chiropractor, a lot of people are concerned about that. The answer is it's not going to cost you anything to get my honest opinion. We'll see if we can help you. I try and incorporate a little bit of an exam into the consultation too, so I can have a look at, you know, what really is going on, if I can identify a tissue that you may have injured, or maybe if it's something more less obvious than that. So I thought I'd take an opportunity to actually show the audience how I would go about adjusting a patient, the clinical rationales behind why I'm doing what I'm doing, and some very common misalignments and problems that patients might have. So first I'm starting with pelvic and low back pain. A lot of people will complain of, you know, low back, you know, what they call the hip area, pain in that region. I'll just show you where that could be stemming from and how I would go about fixing it. I would start with the patient face down like our test patient is today. I'll have him lift the legs, and when we do that, we see that the right leg is nice and flexible, it goes in nice and far. The left leg is relatively tight. There's a lot of muscle tension on that side, and that's what's preventing it from going any farther than it is. We can match up the two and see that his are pretty far off. They're off by about maybe 4 inches there. So that's one part of the assessment. We know that this leg has got muscle tension for some reason, the whole leg does. We can then assess the strength of the muscles, because when a joint gets out of place, it actually affects the strength and the ability of the muscles to fire. So I'll have you hold this leg up strong and don't let me push you down. Excellent. So he's good and strong on that leg. The hamstring is incidentally one of the strongest muscles in the body. I should not be able to push him down if he doesn't want me to. We'll try the same thing on this side. Hold up here and don't let me push. This side is relatively weak, and I know he's trying, but there's just nothing coming out of the muscle. The muscle's just not firing properly. We remember from before that this was the muscle that was bound up by more muscle tension on that side. So what we're going to assume is that the pelvis is out of alignment, or the sacroiliac joint is somehow rotated on this side. That'll cause this muscle to be weaker, and that'll also cause the quads in the front to be tighter. So the way we fix that is with just a simple chiropractic adjustment. If we'll have you lie on your side and face me over this way, please. So we put the bad side up, and what we're going to do here is open up the joint to kind of reposition it. We'll have him set one leg straight and one leg bent. Slide forward right toward me. Good, good. I'll have you let me see your arm on the other side. There you go. Pull that through, and the hands go up on the ribs like so. When we're ready to adjust, we have the patient take a deep breath in and blow it out. Good. And the pelvis readjusts itself like that. You can go back face down. So that's all there is to the correction on that. To make sure that everything went according to plan, we'll go ahead and recheck. We will see now that the left and the right, while not entirely perfect, are much closer than they were before. This simply indicates that he might have either a knee misalignment on either side, possibly the other side is involved. But that's where he is now. Not perfect, but quite a bit better. We can come back and recheck this side. Have you hold up strong here and don't let me push again. And you can see that immediately his strength is greatly improved. He can feel that, and I can feel that too. So that's how you know that the joint on this side is in a better position than it was, and that his pelvic condition is going to be corrected. So that's how I would go about adjusting the pelvis. If you want to see a demonstration for yourself, like I said before, you're always welcome to come into the office. Just talk to me, I'll show you what I can do. So in closing, you've heard a little bit about what I have to offer here. You've seen a little demonstration, albeit a brief one. If you have any questions at all, again, you've got my contact information. Just give me a call, stop on by. I'm more than happy to speak with you about whatever sort of condition or service that you are questioning, or maybe you've never been to a chiropractor before. I'm a good one to start out with because I'll take my time and explain everything to you. Other than that, I hope to see you soon.